morning, everyone. Thank you for joining us. I'm just going to wait a couple more seconds to allow everyone else to join in. As you know, we have a few, oops, I accidentally muted our co-host Frank, so I'm going to unmute you, Frank. There we
All
go.
right. No problem.
All right, so as you all know, many of you have joined us on our webinars before. We ask that you keep yourself muted for compliance purposes. Unfortunately, we can't have voice interaction. Apologies there. However, if you have questions, and I know many of you have a lot of questions this morning for Frank, please get your email queued up, Franklin, Franklin, at jblfinancial.com. He is going to be going through those questions probably towards the end, or if he sees a little break in the action. So don't feel as though because he hasn't gotten to your question, he won't. Our goal is to keep this to an hour to be respectful of everyone's time, and Frank's got another Medicare meeting right after, so we want to be respectful of their time as well. So if Frank is unable to get to your questions, he will respond to you by email, or you can always give the office a call if something Frank says today spurs you for a review. Just go ahead and give the office a call, 314-863-0008, and Kelly, our office manager, will make sure to get you on the schedule with Frank during open enrollment. So thank you all for joining us. I am going to turn this over to Frank. One last time, remind you that if you have questions, please email Franklin, Franklin, at jblfinancial.com. If he doesn't get to it during our webinar, then he will get to it sometime after the webinar today, tomorrow, before the end of the week. With that, I'm going to turn it over to Frank to give you all the latest and greatest on open enrollment for 2024.
All right. Excellent. Thank you, Aaron. All right. Hello, everybody. Welcome again. I see new faces. I see old faces. So love to see everyone out there. We're going to be going through a lot of information this morning. A lot of changes are coming up for 2024 that we want you all to be prepared for. So I have a lot of really good information for you all today. So again, any questions, just feel free to email me and I will get back to you with those questions. Franklin at jblfinancial.com. So without further ado, I know everybody has been waiting to hear a lot of the good stuff that's happening for next year. So that's exactly what we're going to do. We're going to get right into it. So if everyone can direct their attention towards my screen here. Okay. We're going to start with Medicare Advantage plans and what we're seeing for next year. All right. So one of the best plans in the nation here, we're going to be looking at Graph C, right? Aetna Gold Advantage, HMO. So for this year and years beyond that, before this, the plan was known as the Aetna Gold Prime Advantage HMO. So if you got a letter in the mail, if you're on this plan, one of the many clients that are on this plan, and you got a letter in the mail saying that your plan had a name change, all they did with the plan was they dropped the prime. So now it's just known as the Aetna Gold Advantage HMO. So you'll no longer have that prime on the name. Okay, so some really, really good stuff, some attractive things happening with this plan next year. Okay, so we know that with Medicare Advantage plans, you're not paying the insurance carrier for your plan. Okay, you are still paying Medicare, and the Medicare amount is going up next year to $174.70. Okay, now for folks that are drawing their Social Security benefits, that will just go directly out of your Social Security benefits each month. For folks that are not drawing those Social Security benefits, then you are billed quarterly for 3 months. So $174.70 per month is going to be the new Part B premium. For this year, the Part B premium was $164.90, so it did see a little bit of an increase. Now, with Medicare Advantage plans, you're just making copays towards your maximum out of pocket. So one thing that makes this plan very attractive is this low max out of pocket here, $2,400 max out of pocket. Okay, so that means if you go in network and you're making copays and you make copays up to $2,400 in the year, you have no more health expenses for that year. So great max out of pocket, very attractive. Their primary care specialists are $0, and your specialist, your primary care physicians are $0, and your specialists are going to be $20 copays. Okay, that went down as well. The specialists are $20 next year, so very good there. The outpatient hospital went down from $320 to $250 for next year. So really good improvements so far overall under this plan. One thing that you guys may have heard me talk about on the radio in the last couple of weeks is the copay card. Okay. So the copay card, this works in conjunction with your max out of pocket. So you have a $2,400 max out of pocket, but Aetna is going to give you $200 per quarter under this specific plan, the Aetna Gold HMO, $200 per quarter to go towards copays at the hospital, at the doctor's office, copays for lab work, and also copays for vision and hearing. Okay, so essentially that's $800 out of the year that you're getting the insurance company to pay for your copays under this plan. That's very, very excellent. And again, this $200 per quarter is going to work in conjunction with your maximum out of pocket of $2,400. So that means essentially you would pay $1,600 max out of pocket on this plan. So that's awesome. That's very incredible that they're doing that for this specific plan. The dental for Aetna went up again next year. So it was $2,000 for this year. Next year, you're looking at $3,250. So an extra $1,250 worth of dental. Now, that is absolutely excellent because of, folks are getting, bridges and crowns and things like that, implants, and we know how expensive this stuff is getting every single year. So for them to give you another $1,250 will take care of another crown or another implant. So that is very, very excellent. Now, the thing we love about Aetna Dental is that they do not have a dental network, so you can go to any licensed dentist in the country, okay? So very good there. That went up. The eyewear, that went up as well from $300 to $405. So you'll get an extra $105 to go towards your eyewear. The hearing aids also went up from $1,250 last year to $2,000 per ear, and that's every 2 years. And then the over-the-counter benefit also increased. That was a $60 per quarter benefit that you got. That is now doubling to $120 per quarter. So that is absolutely fantastic. That over-the-counter is for your Tylenol, your Advil, toothpaste. They have, compression socks, knee braces. So take advantage of that. These benefits, folks, they will start for you in January. Of course, you will finish out your plan under this year, and then you'll get the new benefits for January. So I always like to tell folks, especially towards the end of the year, if you have any of your benefits left from this year, try to use them, try to maximize them to the fullest capability, because it's not going to roll over next year. So you won't get additional, but it will start over and you will get the new benefits for the next year. All right. So last thing about the Aetna plan, okay? All the plans come with some sort of a gym membership, whether it's called Silver Sneakers or whether it's Renew Active, okay? You're gonna have a gym membership already paid for inside of your plan, okay? So SilverScript, they did not have Lifetime Fitness on their gym. So what Aetna did is they said, we're gonna roll out a fitness allowance for our clients who want to go to other gyms that are not on the Silver Sneakers approved list. So next year, okay, they're giving out a $1,200 fitness allowance on the Aetna HMO plan, okay? And we're gonna talk about some of these other plans too, but specifically $1,200 under this HMO plan, okay? Now, I want to redirect your attention here, okay, to exactly what we can do with this $1,200. Okay, so under the fitness allowance, okay, Fees can be paid to a qualified physician health and or fitness club that does not participate with the silver sneakers. So again, that means if you want to go to Lifetime Fitness, they're going to pay for your membership up to $1,200 for the year. Okay. Aerobic fitness activity fees paid, including those paid for personal training, lessons, coaching, or exercise equipment. So if you want to get a personal trainer, or if you want to get like a row machine for your home, or some weights or some yoga balls or something for your home, that $1,200 will cover that. Activity fees such as pickleball fees, golf green fees, ski lift passes and fees, national and state park fees, bowling, yoga, stretching, dance classes, and fees associated with extra features at Silver Sneakers facilities. So that is absolutely excellent, folks, that this is going to be paying for fees for you. And this is going to work exactly like the dental benefit. So with a dental benefit, most dentists, you will pay up front, you'll collect the receipt, and then you'll fill out the reimbursement form and submit that to Aetna. So that's how this fitness allowance is going to work. You're going to pay, you're going to fill out the reimbursement form, and then you're going to submit it to Aetna or give it to me and I'll submit it to Aetna for you. Okay. And then they're going to pay for up to $1,200 for that. And we're not finished. Activity supplies such as camping tents, hiking poles, and fishing rods, weights and fitness supplies such as exercise peddlers, yoga mats, and exercise bands, and wearable items such as athletic shoes and tracking devices. So that is absolutely excellent, folks. They are going to pay for, if you wanted, $1,200 worth of shoes and tracking devices for you. So very good stuff. The PPO plan for folks that are on the Aetna PPO plan, okay, you also get an identical benefit for that plan. Okay, so we're going to redirect our attention back to our graph here. Okay, so Aetna rolled out a new PPO plan for next year. Now, if you're one of the folks that are on the old Aetna plan, the Aetna Elite PPO, either coming to the HMO or the new PPO is going to be beneficial for you. Okay. So the Elite PPO is one of the only PPO plans that still has a deductible attached to it for Medicare Advantage plans. Most of these Medicare Advantage plans, as you can see, do not have a deductible. So that Aetna Elite PPO is really the last one standing that has a $500 deductible. Okay, with the new plan, Aetna SmartFit PPO, they drop and waive the deductible. No deductible on the new plan. Maximum out-of-pockets on the PPO. We know the PPO max out-of-pockets are a little bit higher because you get that access to use your plan in-network and out-of-network. Okay, so $4,500 maximum out-of-pocket in-network compared to $3,900 maximum out-of-pocket in-network on the new plan. So you're going to have a lower maximum out-of-pocket on the new plan, no deductible, and lower max out-of-pocket. Okay. On the new plan, $1,500 worth of dental versus $1,000 on the old plan. So they'll give you $500 more for dental as well. Okay. So really some good improvements on this new Aetna SmartFit PPO. Okay. You also get the $1,200 fitness allowance on the new SmartFit PPO. But on the Elite PPO, you still will get an allowance. It's just a little bit lower, $600 a year for that. Okay. Now, one thing that they do differ from is how they cover their prescription costs. Okay. So it is important to give me a call and let me know what your prescriptions are to see if it's a good idea to switch you into the Aetna SmartFit PPO. So as you can see here, retail 30 days preferred pharmacies. Okay, what these graphs mean is that this would be reflective of a tier 1 medication at zero cost. This would be reflective of a tier 2 medication at zero cost. This would be a tier 3 name brand like Eliquis and Ozempic at $47. And this would be a brand new drug on the market, a tier 4 at $100. So you can see here on the old plan, your generics, tier 1 and tier 2, don't cost you anything. Now on the new plan, okay, If you're on a tier one, your tier one will still be covered. But if you're on a tier two, you're going to have up to a $10 copay. Okay. And then the big difference is going to be how they cover their tier three and their tier four. It's not a set price, it's going to be a percentage. So you're looking at 20% of the retail for a tier three and 50% of the retail for a tier four. So if you're one of the folks that are on the Aetna Elite PPO, okay, or maybe you have the United Healthcare Walgreens PPO plan, okay, what you'll want to do is you'll want to give me a list of your prescriptions and we can see if it makes sense to put you in the Aetna SmartFit PPO so you can take advantage of all of those other benefits that they have. Okay. Now, speaking of United Healthcare, okay, we have a lot of folks that are on these plans as well with United Healthcare. Okay. So United Healthcare, they still have their two options for their HMO plans. Okay. And they still have their option for the PPO plan, which is a very good PPO plan, just like the Aetna plan. Now, again, the United PPO does not have a deductible. Okay. And what we really saw with changes with United with the PPO was the max out of pocket decreased by $3,000. So that is absolutely huge, folks. So your liability for the last 5 years under most of these Medicare Advantage PPO plans has been upwards of about $10,000. So they cut that in half. $5,750 is going to be the maximum out of pocket for in-network and out-of-network coverage. So that is absolutely excellent. Not as big as of a liability as $10,000 nearly. So that's absolutely great. Okay. So AARP, which is just United Healthcare, folks that are on these plans just pretty much remain stable in that they kept mostly everything the same for next year. Again, really the big change was the max out of pocket on the PPO. And then on their HMO plan number 2, they did up the dental by $5,000. So they give you $2,500 now. It was $2,000 for this year. So they did up the dental to $2,500, but the max out of pocket did stay the same. They did not decrease that. They did not decrease that max out of pocket. They kept it the same. They stayed stable. $3,400 max on that. Okay. Anthem also did pretty much the same thing as United Healthcare and kind of stayed stable. So folks that were on the Anthem plan, one of the things that Anthem had was they had $10 for their tier 2, just like we talked about on that new Aetna SmartFit plan. Okay. However, they did get rid of that on their HMO plan. So for folks that are on the Anthem plan, you will no longer have to pay up to $10 for your tier 2 medications. All right. So that was very good from Anthem. And then Anthem HMO, $1,500 dental, that stayed the same. And then Anthem PPO, $1,750 worth of dental, that stayed the same as well. The PPO also kept its maximum out of pocket high. So here we go. Here's the liability right there. Up to $8,950 would be the maximum out of pocket for in-network and out-of-network. So they did keep that the same. They did not lower that like everyone else pretty much did. United Healthcare, Aetna, and even Humana lowered their PPO as well. So when it comes to these plans, all right, it's all about drug costs. What is going to make the most sense? Who's going to cover my prescription drug costs the best? And then what sort of extra benefits do I get with that? So you'll want to give me your drug list and you'll want to give me your doctor's list. We always want to make sure doctors are in network to see if it makes sense to go with one of these plans. Now, for example, why I would not recommend a plan. So let's just say you're on, a lot of different sort of medications, because all these plans have different formularies whenever it comes to your combination of medications. So let's just say you're on a lot of different medications and United Healthcare is saying they will cover your prescription drugs for $500 a year. So for the entire year, all you'll spend is $500 on your prescription drugs. Well, let's just say Aetna is saying for that same combination of drugs, they'll charge you $3,000 for the year. Well, then it wouldn't make sense to switch to the Aetna plan if they're going to charge you $2,500 more for your prescription costs. So it's all about the prescriptions and those formularies and what's going to make the most sense. Who's going to pay for my prescriptions the best, and who's going to give me those extra benefits on top of that. Okay. So now what we'll do is we'll direct our attention back to Medicare, and we're going to go over reasons, and I'm going to give you all scenarios of why we need to change or why we need to have these discussions on if it makes sense. All right. So we're going to start with Medicare Advantage, okay? And then I'm going to transition into traditional Medicare. So with Medicare Advantage plans, okay, that we just looked at, like the Aetna plan, we know that these are HMO plans, health maintenance organizations. We know that that means you have to stay in network on that plan versus a PPO, a preferred provider organization, to where you can use your plan in network and out of network, okay? So when we're looking at these plans, one thing that we do, of course, is put in your medications. Now, for next year, there are some changes. As I mentioned, your Part B is going up to $174.70. For the most part, the Medicare Advantage plans are going to remain premium free, meaning you are not paying the insurance company like you would with a traditional Medicare plan. Okay. We know that you have a threshold, so there's a protection point so that you're not just incurring thousands and thousands of dollars in health expenses. We know that there's a protection point, and that protection point is usually anywhere from around $2,300 or so to about $8,900, with what we saw with the Anthem PPO plan. That's going to be the highest. That's going to be the max there. Okay. They are all inclusive plans, meaning your prescriptions are already going to be tied into your plan. Now, your copay at the pharmacy depends on what level, or what tier is what we call it, what tier your medication is. So for instance, when we were looking at that graph, I showed you all the chart that it had 0, 0, 47, 100. Those are the tiers. Typically, tier 1 and tier 2 are going to be $0 copays, as we saw on the graph. Some tier 2s may be $10. And again, it just depends on how many tier 2s you have, if it makes sense to be on a plan like the SmartFit plan, okay? And we know we're making copays always working towards that maximum out of pocket. Now, the brilliant thing about these Advantage plans is that since you're not paying the insurance company every month for your plan, we know that this national average is a $2,300. The national average on hitting that max out of pocket is 1 out of every 7 years. Okay, so I just want everybody to kind of think about this long term. Okay, so if the national average is 1 out of every 7 years, how many times in the last 7 years do you think that you've incurred $2,300 in copays? So in the last 7 years, $2,300 in copays. Okay, maybe you've done it once, maybe you've even done it twice. Okay, I don't know. But for most of you, probably not. You probably have not gotten anywhere close to paying $2,300 in copays in the last 7 years. Okay, so when we think about things more long-term, these Medicare Advantage plans are starting to make a lot more sense. Because in 7 years, if you hit this number one time, $2,300, versus a Medicare supplement plan that averages about $150 premium a month, that's $1,800 a year that you're paying the insurance company, okay? So in a span of 7 years, if you're paying them $1,800, you're going to come out on top on your Medicare Advantage plan, because you're only going to hit that one time out of every 7 years. Okay, so when we think about it more long-term, it makes a lot more sense to be on these, to take these Medicare Advantage plans. Okay, so let's look at exactly how the coverage works. Okay, I'm a visual person, so I know I probably have some visual people out there. So I like to see things. I showed you in the graph, but I like to see things like this as well. Okay, this is where it really starts to make sense. So there's your maximum out of pocket there, $2,300. And again, we're just giving examples. Okay, this is not the Aetna plan. This is actually an Essence plan. Okay, so max out of pocket $2,300. Okay. And every time you use your plan, for the most part, you're going to make a copay. Now, we know that copays typically are $150 or less. Really, the only thing that's going to be over $150 are going to be things like radiology services, so MRIs, CAT scans, EKGs. Another one would be inpatient hospital. If you're hospitalized, that would be over $150 copay, as well as any sort of outpatient. So if you have to have like a knee replacement, or a shoulder replacement, that may cost you like $250 copay. Okay, so for the most part, things are going to be under $150. Most carriers have waived their referrals already for their HMOs, so they no longer require referrals. Okay, so when you go to your primary, you're not going to pay. Most carriers will cover your primary. You go to a specialist, you may pay a $20 copay. Diagnostics, $30. Lab services are typically covered with Essence and Aetna. Here we go with radiology services, up to $200. So not necessarily always over $150, but they can be up to $200. X-rays, $20. Emergency care. So let's pause here, okay? So what these plans have done to strengthen themselves is that they've broadened their networks. And we're not only talking about in the St. Louis area and beyond, but we're talking about nationwide. They've really strengthened and broadened their networks. So Aetna and United Healthcare, okay, those are two of the best companies whenever it comes to the Medicare Advantage plans. The reason being is because they're going to have the largest networks of doctors, okay, and hospital facilities all across the country. So what they've done is they've added a national network. So what that means is whether you have an HMO plan or a PPO plan, it doesn't matter, okay? As if you're out of town, let's say you're out of state somewhere, let's say you're up in Montana somewhere, as long as that doctor or that hospital facility accepts any plan through Aetna Medicare Advantage or any plan through United Healthcare Medicare Advantage, they are going to consider you in network, okay? So that means you can use your plan for everything out of state, just like you can here in St. Louis. You want to get an MRI up in Montana, you want to get an MRI in Idaho, you are free to do so as long as that doctor accepts any Medicare Advantage plan through Aetna or United Healthcare if you have that, okay? That also brings us into emergency care. Note how it says always covered, okay? So that means no matter where you are domestically, you are going to be covered at $125 for any emergency care. And then also note here, any urgent care services, so the TAUCs, the Mercy, urgency cares, anything under the urgent care sector is going to cost you a $35 copay. All right. Something a little bit more serious. So some inpatient hospital, $230 per day, days 1 through 5. And then you are covered from day 6 and onward up to 90 days. Outpatient hospital, $230. Okay, so there's our knee replacement, there's our hip replacement, there's our surgeries, $230. Okay. Skilled nursing. Okay, so skilled nursing, they'll cover the first 20 days. You'll pay $125 per day, days 21 through 100. Anything over 100 days, Medicare is not going to cover because they are going to consider that to be long-term care, okay? So it's important if you need some sort of coverage over 100 days to look into getting some sort of long-term care for that. Okay. Preventatives are going to be covered. So we're talking flu shots, mammograms, colonoscopies, vaccines. All of that is going to be covered. Ground ambulance and air vac. Okay, that's huge. Air vac is the exact same copay as your ground ambulance, $220 copay on that. And then therapy sessions, okay, $30. Now with the Aetna HMO plan, those therapy sessions are $15. So again, if it makes sense to switch you to that plan, we can do so. All right. So we know that anytime we're making these copays, we're contributing towards that $2,300 maximum out of pocket. So again, these HMO plans are going to have very low and affordable max out of pockets. Okay. As far as prescriptions are covered, what I wanted to do was to give you guys an example of prescription calls without hitting the donut hole, and then prescription calls hitting the donut hole. So we'll take a look at both of these options here. So prescriptions. I just threw in a couple of tier 1 prescriptions, but I want you all to note that everyone is going to have their preferred pharmacist. Okay. You'll see that they have in-network pharmacies, but you'll see costs associated at in-network pharmacies. So for instance, if you went to the medicine shop, your total yearly drug cost for 2 generic drugs, atorvastatin and levothyroxine, would be $94.20 versus a preferred pharmacy to where your prescription costs would be covered. So it is important, if you are on these plans, to make sure that you all are going to preferred pharmacies. Every now and then, you might forget. I tend to get a handful of people that they'll call me and they'll say, "Yeah, Frank, I went to go pick up my medication and it's generic, but they charged me for it." And I always say, "Okay, well, let's talk about it. What plan are you on? Okay, Aetna. Okay, where'd you pick up your pharmacy, or where'd you pick up your prescription?" "Oh, I went to Walgreens to pick it up." "Okay, well, that was it. You went to Walgreens and Walgreens charged you when your preferred pharmacy was actually CVS. Okay. So that's something to definitely pay attention to. Now, let's look at something that would put us in the donut hole. So a common medication right now is Ozempic. Very, very popular medication. Ozempic, Eliquis, Rybelsus, Restasis. These are very popular medications that we see folks hitting the donut hole no matter what plan you're on. No matter if you're on a Medicare Advantage plan or if you have a traditional Medicare plan, like a Plan G or a Plan N that we'll talk about here shortly, with a standalone drug plan, those 4 medications, you are going to hit the donut hole. That's Ozempic, that's Eliquis, that's Rybelsus, that's Restasis. Okay. So you'll see here, total yearly drug costs, okay, $1,100 for the year for Ozempic. Now, what is that going to look like from a monthly standpoint for folks that are on these 4 medications? Okay, so let's scroll. And we'll see here, $42 copay at the pharmacy. All right. Pretty much through more than half of the year. And then look what happens in August. You go from paying a set amount, $42, to now paying an inflated cost, $133.36. Okay, this is called partial donut hole. This is partially in the donut hole. And then for the remainder of the year, when you're inside of the donut hole fully, $168.61. Now, let's pause, okay, and let's take a look and see how we are going to hit the donut hole for next year, okay? So every drug plan is going to have 4 stages of coverage. You have a deductible stage, you have your initial stage, you have a coverage gap stage, and then you have a catastrophic stage. Now, there's a big change with catastrophic change for next year that we'll get into, but let's start at the beginning. So if your plan has a deductible, And in fact, most Medicare Advantage plans do not have a drug deductible. We saw the $500 health deductible on the Aetna plan, but a separate drug deductible on the Medicare Advantage plans. Most of them do not have that, okay? So basically, you are going to start in your Medicare Advantage plan already at stage 2. You're going to start at initial coverage. Now, folks that have a standalone drug plan, so again, traditional Medicare or straight Medicare, those will typically have a deductible. The lower your monthly premium, the higher the deductible is going to be. So for example, if you're a person that's on a WellCare prescription drug plan and you're paying them $11.20 a month, you may have a $505 deductible attached to that. Now for next year, the maximum deductible on those standalone drug plans is $545. So typically on a tier 1 and tier 2 medication, you do not pay the deductible, okay? But if you're someone that's like on one of the 4 medications that I mentioned, you will pay that deductible first, okay? Deductible for next year, the maximum deductible would be $545. But again, for the folks that are on the Medicare Advantage plans, those do not have deductibles, so you are right in the initial coverage stage. So all the initial coverage stage means, okay, is that you are paying a set amount according to the plan's formulary, okay? So that's exactly what we have up here, the plan's formulary. Now, most plan formularies, and we looked at the Aetna plans on their formularies, most plan formularies, you're going to be looking at $0 for tier 1 and tier 2. This one has up to $5, but most of them have $0 for your tier 1 and tier 2 medications, as we saw with our example with this plan that we looked at here. Okay, $0 there for tier 1s, tier 2s. Okay, tier 3, up to a $42 copay. We saw that with our example in this situation with the Ozempic. Okay, you're paying $42. You're in your initial stage. You're just paying what the formulary tells you, $42. Okay, then any sort of tier 4 brand new drugs on the market are 50% of the retail cost. So those are going to be very expensive for you. Specialty tier, that's going to be if you have some sort of like injection or infusion that you give yourself at home, you will pay 33% of the retail cost for that. Now, if you get an injection or an infusion at the hospital or the doctor's office, that is going to be considered medical. So that is going to be paid by your plan. You'll pay 20%, the plan will pay 80% for those. But if you go get it at the pharmacy and you do it yourself, you're going to be paying 33% of that monthly retail cost, okay? So all you're doing is you're paying $42 a month for your medication in the initial stage, okay? And what Medicare is doing is they are tracking the insurance company and how much it retails for every single month, and they are tracking how much you're paying every single month. They're adding those two numbers together every single month, okay? And then when you and the insurance company together next year get to $5,030, you will enter the donut hole. Okay, so during the donut hole, you are paying 25% of the retail cost of the medication. So again, that's why we see the jump here with Ozempic and Eliquis and Restasis and Rybelsus, is because you would be going from paying that $42 set amount to now paying 25% of the retail cost. Okay, now the big thing for next year is whenever you hit catastrophic coverage. So again, Medicare is tracking how much it retails for every single month, your prescriptions, and how much you're paying for it at the pharmacy every single month. They're adding those numbers together. And then once you and the insurance company get to $8,000, you are done paying for your prescriptions for the year. So that's a little bit different than how they did it for this year. Because for this year, whenever you hit catastrophic coverage, you were still responsible for 5% of your medication costs. So next year, if you are to hit catastrophic coverage, you're going to be done paying for your meds. So that's very, very good for folks. And then the year after that, so when we're looking at 2025, hopefully this will still stand true after elections and everything else. They're supposed to cap it off at $2,000 for the year to be your total drug cost. So that's going to be your maximum out of pocket for your prescriptions, $2,000. So excellent stuff there that they're doing. So I always like to advise people on ways to kind of save on medications. Mark Cuban has a website, costplusdrugs.com. Okay. And you can run your medications against this website. You can actually go down here and you can, I was just playing around with it earlier. You can go by conditions. You can look at prescriptions that they have, and you can see your savings here. Okay. So this is one way to save on your prescriptions. Now, not every prescription drug is going to be on this site. Okay, so if something is not on this site, another one you can use is GoodRx or any of those RX saver programs. That's always a good way to save on your prescriptions. Okay, as well as you can ask your pharmacist if they have any other discounts at the pharmacy, and typically they will apply those discounts for you. So you are paying a little bit less, especially for those tier 3 and 4 medications. So that's really good stuff. But this is a very valuable website, costplusdrugs.com. Okay. And you can see here all of the savings for some of these neurological drugs. That is very good, folks. Okay, costplusdrugs.com. Another one that folks have told me about is Amazon. Okay, I'm getting some good feedback on Amazon that their drugs are a little bit cheaper too. Their prescription costs are a little bit cheaper as well. Okay, so Medicare Advantage. All right, last thing I just want to mention with Advantage, folks, is that, of course, we talked about the dental, the vision, the hearing, the extra benefits. So they are all inclusive, no cost to you. And if you are someone that anything has changed with prescriptions or anything has changed in health, if health has deteriorated, or even if health has improved, email me with your med list and your doctors, and we can see if it makes sense to put you in a Medicare Advantage plan, HMO or PPO, or go with a traditional Medicare plan. Okay, so that kind of brings us into traditional Medicare. All right, so traditional Medicare, these are Medicare supplement plans. So how these plans will work is that you have your Medicare Part A covering your hospital, inpatient, outpatient, home healthcare, hospice. Okay, you don't pay anything typically for Part A. Normally that's going to be covered for you because you paid your Medicare taxes. And then you're going to have Part B covering your medical and doctors. Part B is what you pay Medicare for. That's that $164.90 for this year. Next year, it's moving to $174.70. Now, for folks that have to pay a higher premium for their Part B, okay, they're going to do a 2-year look back every single year at your adjusted gross income. Okay, whether you file individually or whether you're married and you file jointly. Okay, if you are over filing jointly, if you are over $206,000 next year, then you will pay $244.60 for your Part B. Anything under $206,000, and you'll just pay the standard $174.70. Okay, and you can see the chart here. Okay, if you're single, $103,000 or less, you'll pay the standard. Anything from $103,000 to $129,000, you'll pay the inflated costs. Again, they do a 2-year look back on this. So let's say you had a really good year, but you were going to retire or something like that, some sort of life-changing event happened. We can appeal these higher brackets, okay? It's called the income-related monthly adjustment. And all it takes is some sort of life-changing event, and we can appeal these to get you back to the standard, okay? So just call me, or send me an email. Let me know if that's something that we need to do. I can get you over the paperwork and we can submit that to Social Security for you. Now, most people are going to be in that 174.70. Okay, so expect that change next year from 164.90 to 174.70. Okay, so A and B under traditional Medicare is going to cover you at 80% coverage right away. So everyone, or most of everyone in here, is probably on Medicare. If you're new to Medicare, that's fine. You're going to get what's called a red, white, and blue card. Okay, and that's going to have your Medicare Part A and B on your card. You show that card to your doctor, and that's 80% of your health coverage right off the top. Okay, so supplemental plans. Since you have 80% coverage, what happens to the additional 20% that Medicare is not picking up? You would have to purchase a Medicare supplement plan. Okay, as you can see here, they're pretty much listed from A through N with the exception of a couple of letters. Okay, now the Cadillac of the plan recently has been the Plan G. Okay, the Plan F was an absolute great plan. And as you can see here from the chart, okay, if it's got a green, that means it's covered. So the Plan F covered absolutely everything. It was 100%. If you were on Medicare prior to January 1st, 2020, then you got to keep your Plan F. You just got grandfathered in there. So for folks that have the Plan F, okay, we can continue to shop those plans every year, meaning we can continue to look for cheaper prices from other insurance companies on the Plan F. Because every single Plan F is the exact same. Every Plan G is the exact same. Every Plan D is the exact same, and so on. All the plans are standardized. Okay. Government makes the rules of the plans. Insurance companies just control the price. Okay. So the Plan F discontinued, but if you still have it from 2020, we can still shop that. The Plan G is the Cadillac of the plans now, covers everything except for the Part B deductible. The Part B deductible, $226 for this year, and that is going up to $240 for next year. So that will see an increase as well. So with these supplemental plans, we know you have to pay an insurance company for them. So for example, if you had a Plan G, you may pay Anthem or Aetna or United Healthcare about $150 a month. Okay. And then again, you would be responsible for that Part B deductible. Okay. $240 next year. A really good alternative to the Plan G, okay, is the Plan N. And I know some of you might be looking like, well, what about that Plan C? It looks like it covers everything except for excess charges. The Plan C, the reason that a lot of these plans don't make sense is because, yes, they do have a lot of holes in them, but also a lot of them are more expensive monthly than the Plan G and the Plan N. So for example, the average of a Plan C is about $200, okay? To whereas the average of a Plan G is about $150. Even after you pay the $240 deductible, you're still coming out ahead on that Plan G, okay? Plan N, the reason we like Plan N, because they have low monthly premiums, okay? It would make sense. There are a couple of holes within the Plan N though, okay? Just like the Plan G, you have the $240 deductible, and then you have your excess charges. So excess charges, okay, your doctor agrees to a certain amount with Medicare. They agree to pay a certain amount. Excess charges are where your doctor can charge up to 15% more than the Medicare approved amount, okay? Now, most of you on these Medicare supplement plans will hardly ever see that, but it is still a hole that we like to make sure that you are aware of if you do get this plan, okay? So excess charges, the Part B deductible, and then as well as $20 every time you go to the pharmacist or every time you go to your primary care physician, and $50 at the ER. So you do have additional copays with that Plan N. Okay, but in all sense, the plan G, about $150 a month, the plan N, about $120 a month. Okay, so it is going to be a little bit less than the plan G. But depending on how many times you go to the doctor or the hospital, would be how we kind of determine if you should be in a plan G or a plan N. Okay. So for folks that are on the traditional Medicare plans, these are non-network plans, meaning you can take your plan anywhere and use it. As long as the doctor or the hospital accept any Medicare Advantage plan, or excuse me, as long as the doctor or the hospital accepts any Medicare in general, then they have to accept your Medicare supplement plan. So a lot of folks do like that flexibility of having that option to, you know, if you're out of the state, knowing that you're going to be covered, you're not going to have to ask permission to go to any doctor or anything like that. Now, that is exactly what the PPO is designed to do, is to work exactly like your traditional Medicare supplement plans, into where you can take them anywhere in the country and you're going to have coverage. Okay, because that PPO, again, that PPO is going to give you in-network and out-of-network coverage, meaning you don't have to go to doctors that just accept Aetna if you're on an Aetna plan, or you don't have to go to just doctors on the United plan. You can go to doctors that don't accept them because you have the PPO plan. Most of you probably had PPO plans whenever you were employed. It was either a PPO plan or an HMO plan. So you're used to how those Medicare Advantage plans work, and that you have to have a network. But what really opens you up is the PPO plan. Okay, again, because you can use it in and out of network. So this is going to be the year, if you have a traditional plan, to either shop that traditional plan. You all should be getting things in the mail from your insurance carriers with any premium increases. You should be receiving that, or you should have received that at some point this year, with any sort of premium increases. And then depending on how much it goes up, typically we see about a 3 to 8% for premium increases every year. Depending on how much it goes up, you may want to look at joining a Medicare Advantage plan, because again, you're not paying those insurance companies directly each month. You're only paying when you have to use those plans. Okay. And again, think of this, folks, as a bigger picture. We're talking about a 7-year picture. Okay. Within the last 7 years, how many times have you paid up to $3,000 in health calls? Okay. Was it one time? Was it 2 times? May have been 0. Okay. So if we're looking at things from a longer term period, okay, this is the year to look at joining these Medicare Advantage plans, because they continue to get stronger every year and these benefits are getting better and better. So I think we have time for a few questions if I've got some. We got about 4 minutes, folks. So let's see. Med list, okay. Let's see. United Healthcare Plan has significantly increased many service copays. How can we most easily compare Advantage Plan copays across providers to determine if UHC increases might be on the move to another provider? Okay, very good. So, Bob, what you'll want to do, okay, I'll share my screen again. Okay. So what you'll want to do, Bob, is you'll want to go to this Medicare.gov site. All right. Now on the Medicare.gov site, to compare these plans, all you'll do, excuse me 1 second. Okay, to compare these Medicare Advantage plans, all you'll do, okay, let me go back for you. Okay, you'll put your zip code in. and you want to look at Medicare Advantage Plan Part C. Okay, so on these Advantage plans, Advantage is known as Part C. So that's the one you're going to want to click on. If you don't get any help from Medicaid, supplementals, Medicare Savings Program, any extra help, then go ahead and select I don't get help from any of these programs, and you're going to click Next. Okay, and then this is where you're going to be able to add your prescriptions. So you can click Add a Drug, and we can type in, let's do Eliquis. We'll just add our prescription, put your frequency in, how many you take. Okay, once we're done adding drugs, this is where you will select your pharmacies. Okay, typically, we always like to check a Walgreens and CVS because they're on every single corner. Can't go anywhere without seeing them. Costco's a really good option. Sam's a good option. Walmart's a good option. If you have some sort of specific pharmacy that you go to, you'll be able to find it on this list. Okay, and you can search by mile radius, and you can actually put zip code in and the name of it as well. Okay, so like the medicine shop, always like to look at like a medicine shop or something. Okay, then it will bring up plans based on how much your prescription drug cost is going to be. Okay, so you'll notice as you scroll down, that number is just going to increase. Okay, you'll just keep scrolling, it'll just keep increasing. Okay, so that's how you're going to be able to shop the different companies. If you're wanting to take a look at drug plans, you just come over here and you view available drug plans. Okay, and this is going to bring up standalone prescription drug plans. Okay, so the top plan, see there, some company named ClearSpring, $27.30 a month. Total yearly drug costs at the pharmacy, $1,653. There's your drug deductible that we talked about earlier. These standalone drug plans, most of them will have a deductible. Okay, $545 that you would pay first before the plan pays. And that's how you would look at drug plans. Okay. All right, folks. Well, I will get to answer more questions as I go today through my emails. I'll make sure to address those questions for you folks. That's just franklin@jblfinancial.com. So any question, send those to me or give a call to the office, 314-863-0008. Okay, and we'll make sure to get those questions. And that's all I have for you folks. Hope everyone has a great day. I wish we had some, I like to interact with people. So I don't like the whole mute thing, but I guess we have to do that for compliance. So otherwise I'd have everybody unmuted. We'd be having some discussions, but hope everybody has a good day. Y'all take care.